Every year, millions of people around the world are bitten by snakes, but nowhere is the toll as devastating as in India. According to the World Health Organization, about 5 million snake bites occur globally each year, leading to up to 2.7 million cases of envenoming. In India alone, estimates suggest that between 50,000 and 60,000 people die annually from snake bites. This number is staggering, especially when compared to the much lower official reports, which often record only around 1,000 deaths per year. The gap highlights a major issue of underreporting and reveals the true scale of this hidden crisis. You might wonder why there's such a huge difference between official statistics and survey-based estimates. The answer lies in how deaths are reported. Many snakebite victims never reach a hospital or formal health facility. Instead, they may die at home or after seeking help from traditional healers. These cases often go unrecorded in official data, leading to a significant underestimation of the true death toll. This underreporting makes it difficult to allocate resources and plan effective prevention strategies, leaving many communities vulnerable year after year. One of the leading causes of snakebite deaths in India is the delay in reaching appropriate medical care. In many rural areas, victims often first visit traditional healers instead of heading straight to a hospital. Studies show that over 60% of victims receive first aid at the site, and about 20% seek hospital care only after consulting a healer. Poor transport infrastructure and long distances to medical facilities further compound the problem, resulting in critical delays that can mean the difference between life and death. Even when victims reach a hospital, timely and effective treatment isn't always guaranteed. The production, quality, and distribution of antivenom in India face several challenges. The big four snakes, Indian cobra, common kite, Russell's viper, and saw-scaled viper, are responsible for about 90% of serious bites. While polyvalent antivenom exists, issues with supply chains and administration delays can prevent patients from receiving life-saving treatment in time. Many rural clinics and primary health centers in India lack the necessary infrastructure and trained staff to manage snakebite emergencies. Without proper resuscitation facilities or staff trained in snakebite management, even those who reach a clinic may not receive the care they need. This lack of preparedness is a significant barrier to reducing snakebite mortality, especially in remote and underserved regions. Another challenge is the lack of comprehensive data. Because many snakebite cases are treated outside the formal health system, official statistics often miss a large portion of deaths. This data gap makes it difficult to understand the full scope of the problem, hindering efforts to target prevention and allocate resources effectively. Accurate data collection is essential for designing interventions that can save lives. Snakebites in India are closely linked to occupational and environmental factors. Most bites occur in rural agricultural settings where people work barefoot, sleep on the floor, or walk through fields at night. The risk increases during the monsoon season when snakes are more active and people spend more time outdoors. These environmental and lifestyle factors make certain populations especially vulnerable to snakebites. Lack of safety knowledge and preventive behavior is a major reason why so many snakebite deaths occur in India. Simple practices, like wearing protective footwear, keeping sleeping areas off the floor, and clearing surroundings of snake habitats can greatly reduce risk. Unfortunately, many people are unaware of these precautions, and after a bite, incorrect first aid or reliance on traditional remedies can worsen outcomes. Safety knowledge is vital, it's only one part of the solution. Delayed care, poor infrastructure, and reliance on ineffective treatments all contribute to the high death toll. Many deaths could be prevented if bites are identified early, victims are transported quickly, and the right antivenom is administered in a well-equipped facility. The interplay of these factors means that improving safety knowledge must go hand in hand with strengthening health systems. Knowing the correct first aid steps after a snakebite can save lives. The most important actions are to stay calm, keep the victim still, immobilize the bitten limb, and get to a hospital immediately. Do not tie a tight cloth, cut the wound, suck out venom, or apply ice or chemicals. These outdated methods can cause more harm than good. Instead, focus on quick, safe transport to medical care. After a venomous snakebite, panic can actually make things worse. When a person is frightened, their heart rate and breathing speed up and they move more. This increases the flow of venom through the lymphatic system, not just the bloodstream. Staying calm and keeping the bitten limb still slows the spread of venom, giving the victim more time to reach medical help. It's not just about slowing the heartbeat, it's about reducing all movement. There are many myths about snakebite first aid that can be dangerous. Do not tie a tourniquet above the bite, as this can cause gangrene and tissue death. Never try to suck out the venom, cut the wound, or apply ice or chemicals. Waiting to see symptoms before seeking help can also be fatal. The best advice is simple: don't move, don't tie, don't cut, go to the hospital fast. India is home to nearly 300 snake species, but more than 60 are venomous. Of these, 4 species, the Russell's viper, Indian cobra, common kite, and saw-scaled viper, are responsible for the vast majority of serious bites and deaths. Each has a different type of venom and is found in various habitats across the country. Understanding which snakes are most dangerous helps guide antivenom production and public health strategies. While the big four dominate the statistics, India has other venomous snakes that can cause serious illness or death. The king cobra, for example, is the world's longest venomous snake, though it bites less frequently. The hump-nosed pit viper is increasingly recognized as medically significant in some regions. Other vipers and elapids are found in specific habitats, especially in the northeast and forested areas. These species account for a smaller but important fraction of cases. Reducing snakebite deaths in India requires a multi-pronged approach. Improving safety knowledge and preventive behaviors is essential, but so is strengthening health infrastructure, ensuring timely access to antivenom, and collecting accurate data. With coordinated efforts, many of the tens of thousands of annual deaths can be prevented. The key is awareness, preparedness, and rapid response so that a snakebite does not have to be a death sentence. Ayanantinadar.